Good afternoon, Milwaukee, and welcome to another installment of Listen MKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal-Sentinel, the Milwaukee Public Library, and Milwaukee PBS. My name is Teran Powell, and I'm the race and ethnicity reporter at WUWM. I'm co-moderating today's event with Talis Shelbourne, investigative solutions reporter at the Milwaukee Journal-Sentinel. Today, we'll be talking about vaccine hesitancy. And joining us for that conversation, we have Dr. Kevin Izzard, president of the Cream City Medical Society, and Dr. Patricia McManus, president of the Black Health Coalition of Wisconsin. Our goal here is really just to share as much information as we can with you related to the COVID-19 hesitancy and understanding that it is such a nuanced issue. And the conversation doesn't stop here. If you're interested in this topic, our partners at Milwaukee PBS will also be hosting a special on the vaccine that will be airing February 4th at 7 p.m. So with that, let's jump right in. Dr. Izzard and Dr. McManus, thank you guys so much for joining us today.
Hi, good morning.
Hello. Thank you.
So I'm going to pose the first question to both of you guys. I don't think we can have a conversation about vaccine hesitancy and not talk about the role that the medical community has played in it, especially for communities of color. So I'd like for both of you to just discuss the very real traumatic medical history, especially of communities of color, and how it's not even just the history, right? It's also happening in the present as well. But how is that affecting this issue of vaccine hesitancy that we're talking about today?
Mm-hmm. I think at least most of us are at least partially aware of some of the historical things like the Tuskegee syphilis experiment. Or they might be aware of Henrietta Lacks or some other things that have happened in the past where African Americans were entered in studies without their permission. And so I think a lot of us kind of have an idea about some of that. We don't know all the details, but we know that something untoward had happened in the past. But the thing I'm more concerned about now is just this general feeling that people don't feel that the medical system, that the institutions are working on their behalf. They don't think that they don't have the feeling or the security that the medical community, when we distribute medications or we are delivering care, that we're necessarily working on their best behalf. And I know that's something that Pat and I have kind of agree on that.
Mm-hmm.
We have a long way to go. And assuring that people that their information is safe, that they have access, and that the access that they have is going to be in their best interest.
Yeah, and they're being treated like human beings. You're really right in terms of the fact that I don't think people realize how you're still treated. They're like they want to say they said, Tuskegee was back and that was back and all that was back. I mean, I don't know if people saw the Facebook article that was by Dr. Susan Moore, I believe her name was. She died early December from COVID. But listening to her, it just took the way she was treated, even though they realized she was a physician. I mean, we don't even get the courtesy of being treated differently because whatever titles we have or who we are. But the way she was just treated, and then what really shivered, because 2 years ago, I had my first knee replaced like 10, 15 years ago, and this last one kind of went out. So I have that one replaced, and I'm reading this article, and I'm like, God, that's just how I was treated, or should I say, attempted to be treated, because I wasn't having it. That I didn't do anything. They I'm sure they found out who I was, but I didn't tell them my background, and I didn't tell them who I was. I didn't tell anything. At one of these hospitals around here, but I told them that I wanted to meet with the people that were in charge of the floor, and the same thing they did to her, they tried to do to me in terms of if you ask for medication, automatically, you're overdosing, you're doing whatever. You ask for 3 to 4 hours later. I mean, that's why I said I could back up her story, and to think that as sick as she was, I at least just had to deal with pain in my knee replacement. I just felt so sorry for her, and the way the rules are now, your relatives can't be with you even to advocate or something like that. But it was just how she was treated. And like I said, I asked to meet with the folks. maybe they did figure it out. I don't know. But anyway, I met with them, and first thing I told them was I didn't want any one-page, send me a little one-page letter saying we're sorry that your experience wasn't blah, 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 blah. I didn't want any pre-coded letter. I want this investigated. I told them because I felt if I was treated this way, other Black people on the floor probably was so treated, and even some of the white ones. They don't get away with it either, especially if they seem to be poor or have other issues. And so they did it. I mean, it was a 6-page letter they sent me, and actually literally admitted that, admitted as much as saying that there seemed to be a difference in the way, in terms of medication, that people on the floor were treated. And they had these people, folks had to go through, nurses had to go through training, other stuff to do that kind of thing. But I was just because I'm like, well, what are folks who don't have people that can advocate for them? And like I said, okay, this is 2000, that was 2018. And so that's the other thing too, is I think people, they're just bringing up Tuskegee. There's nothing, no, it still is a difference in how we're treated. And a lot of times people know that, but they don't know what to do or who to call. I know, Kevin, do you understand?
That's very true.
Yeah, I don't know if you want to ask.
I agree. I agree that it's not. Yeah, it's not just past stuff, but it's continuing on. And again, it's not even just the health fields. I mean, I think people in general don't trust institutions. They don't trust the police department. Yeah. They don't trust the politicians. They don't trust a lot of these major institutions that they have their best interests at heart.
Mm-hmm. Yeah, and
which makes it harder for us to try to sell things like flu shots.
Mm-hmm. And that's what I wanted to get at next is what kinds of things are people telling you are making them feel hesitant about the vaccine? And to that end, what are you hearing regarding misinformation from patients who maybe are putting forth conspiracy theories and things that lie online about the vaccine? How do you deal with that as physicians?
Mm-hmm.
Yeah.
Well, go ahead, Pat.
I'm
medical professionals.
I'm a nurse. I'm actually better than physicians. I have a whole lot more going, so I just thought I'd throw that out there. Go ahead, Kevin.
No, go ahead. But it is a common thing, and you add on top of that, reluctance, and then you add on limited education, and a lot of people don't know the facts, and so that's kind of a petri dish there to get a lot of misinformation out, and so a lot of our patients are less willing to listen to a professional and more likely to listen to their auntie or their grandmother or cousin. Mm-hmm. Who says such and such, again, because they distrust already the authorities. And so a lot of things in the beginning of COVID, I remember when it first came out back in March and April, we were telling people, you need to take this thing seriously, you need to wear a mask and the distance. And people were saying, oh, Black folks can't get COVID. Well, we see how quickly that changed because we knew, that was not going to be the case. We knew that African Americans, it seems like anything that's bad out there, we tend to get more. And, so it wasn't surprising when we start seeing the first peaks and outbreaks were occurring in the inner city and in Black communities. There's a whole lot of reasons why that is too. But yeah, it wasn't surprising. And so a lot of people, again, they're getting misinformation, and maybe from Facebook, and maybe from other relatives who are getting misinformation, and it just spreads like wildfire.
Yeah, and I think too that it's also excuse me, it's also how I know, Teran, you asked about that we received a grant from the state to educate the Black community, and the things that Kevin just said, as well as other things, is how they're treated when they're in the healthcare system. And man, when I go with I take my sister to see Dr. something or something like that, and it is just an ongoing, and then you're going to get into whether it's implicit or explicit, doesn't matter. It still affects the person that you're supposed to be providing services for when you say things or you assume things about them and you don't talk to them or ask them about anything. And they get that. They know how they're being treated. and they're scared to say anything because then they think it'll be worse, you know, or they'll think something's wrong with them, so they don't say anything. But in these classes that I'm teaching, part of it is I really teach for a little while, about an hour, and then I open it up as a focus group for them, Teran, I think I told you about that, for them to feel comfortable in a setting where they can just say whatever they feel. And many of the things they said are very similar to, I think, what Kevin and I have been saying, that the sense of being treated differently, being not respected, making assumptions that they are poor, that they're, you know, because even if you're not poor, doesn't mean you're not going to get treated a certain way, because they look at your face first, you know. And they, and again, the way Dr. Morris said, you know, in her passing, she was so frustrated in that, you know, she wasn't saying, I'm a doctor, treat me different. She was saying, I'm a doctor, I know what's supposed to be happening. And they just dismissed her out of hand, you know, and they just dismissed her. And there are a lot of folks that would do that. Or if you complain, like I said, they sent out that little 1-page letter telling you that, you know, because I'm just assuming that you're just overreacting and whatever. And so then they don't want to go. I mean, if they get in, they don't. I mean, there are many who said, I shouldn't say many, but enough who basically said that they feel like they're not treated, they're not respected, they're not treated like a human being. And oddly enough, many of the people who care for them honestly don't see themselves doing that. I mean, some of it is that implicit bias where they don't think that they're doing that. And so they don't even want to deal with it or assume, well, they're just they're just overreacting. They just think they're always treated that way. And so it's a lot of that's in it. It's really almost worse. I tell people a lot of times, I said, you know what? I deal much better with the explicit, you know, the one that know they racist. We deal straight, you know, than the ones who get their feelings hurt, you know, if you accuse them of that, or they think there's something wrong with you. But some level of respect and authenticity now, I haven't seen a lot of disinformation given, but clearly misinformation, or which is tied into not telling them the information they need to hear, because they're not telling them that. They think that they're saying they're having more pain, there's more stuff that's going on. Some of that has to be with the memes in terms of the research a lot of those experiments they did on Black people that, you know, they really could handle a whole lot of pain. Well, what choice did they have? You know, so the memes out there that we can handle pain. You know, we don't need as much pain. And if we say we don't have pain, then there must be something wrong with us. But I think a lot of it is folded into not being respected and treated as a human being in terms of someone who has some legitimate concerns. And if I put it all in, even the things that we're pulling together, that's what we're hearing. That's what you hear most of the time, is that they don't listen to me, or they don't believe it, or I'm not a drug addict. Why are they treating me that way? Whereas, go ahead.
Yeah, let me add to that too. And this is more getting at the upcoming flu or upcoming COVID vaccine. We make assumptions that, like, for instance, let's say we're gonna do vaccines. You have to get 2 vaccines. Okay, you gotta show up in that second one. So someone's, you know, really pushes to get that first vaccine. They don't come back in 3 weeks. Well, they're non-compliant. Well, we don't think about the fact that sometimes, like, it's easy if you got a car to drive over to Freighter to get that vaccine, and you got to be there on time. You can't show up late. So, they might have to take 2 buses with their kids to get to Freighter. They have to get through Freighter, you know, and you know, through all those buildings that are over there, and get there on time. So a lot of things happen. Life happens on the way to being compliant, and so you know, a lot of things that we assume that people aren't compliant are issues that they got, real issues in life. You know, they don't have money to pay for their medication this month. They don't have ability to get to wherever it is they have to be, you know, on time. They can't miss a day of work because they've already missed too much work. And if the kids are sick, they're not going to go into the doctor's office if they have to miss work, and they might go to the emergency room because that time is more convenient for them. You know, so these aren't things necessarily that people just being deliberately non-compliant. It's just that they're trying to hustle. They're trying to figure out how to get through life and take care of all those things that are on their plate. And their health might not be the top of it.
Yeah, and you're talking about that, like the the mitigating factors that they have, like talking about trying to get a bus out there. They, I mean, up to recently, there could only be 10 people on the city bus at a time, 10 people. And I think it's up to 15 now. Wow. You know, in terms of the ability for people to try to get to work or even try to get out there. But now behind, you know, when you talk about Freighter and MCW, they got buses that Milwaukee County pays for that zooms those folks from, you know, from Freighter all the way going out the other way to their parking places, to where they got to go. They got plenty of where they can go. Picks them right up, takes them right on out of town fast. They're still trying to figure out how to get there, and they may have a car that just got them there, and then something happened to the car. I saw that happen a couple of times, but no, there's just no real. That you know, you're saying exactly in terms of what we're saying is that you treat people differently based on how you feel about them, or how you feel about them as a collective. And as a collective, they just always think that we're just not doing what we don't want to do. They have no concept of what's going on really in life. You know, that there's no empathy for it. There's no respect for it. And even whether it's done, whether they think they do it or not, it makes it no less hurtful, number one, and also making people feel, forget it. You know, I'm not going to go out there to be treated that way. I'm not going. Then they say, well, they're not coming because they don't care. No, they don't care about their health. They do. But what they don't care about is when people just make offhanded comments based on somebody's race or whatever. I'll tell you, when St. Michael's was still there, I went to see my sister, and I used that in my training. And out there to see her, I just got getting to her room, and I had a UWM sweatshirt or t-shirt, something on, and it said alumni. Somebody give me, you know. And so this nurse walks up to me, and she's got her little meds and everything, and she's looking. She said, "Oh, did you finish?" And I said, "Well, yeah, 3 times, actually." Oh, and my sister with her crazy self, she about hanging out her bed. Did she ask? She said it to me. Yeah. I didn't know what alumni was. Somebody just gave me a shirt and I just put it on. I mean, it comes something like that. You're just kind of like, oh my God, you know, it's just, and I don't even know they do it. And it's no, and it is resentful in some ways. You know, you can deal with it. We learn how to deal with it to some degree. But other ways, you know, you got people who don't have, they live their lives so much harder than people who have jobs or have an education, have something to do, that you don't understand what that means to try to help. A lot of that's a lot of my family, and I try to do all I can with them. And I tell people that I'm really in this house like I am now, because I told them I get threatened with violence if I come out of it, because they want to make sure I'm okay, you know. So
family looking out.
They take care of me, but I'm just like, you know, every once in a while I sneak out and go. I like to do my own grocery shopping just once in a while, you know. But I've been good because this virus scares me, you know. So I try to behave, but even the folks, like I tell people too, if you know someone who lives by themselves, call them, you know, check on them and stuff, because we're finding too many of our people dead. And even they've gone to the hospital, and the hospital don't have room for them, so they come back home. They tell them, you know, rest up, you know, or whatever, rest up. They don't know anything, and then somebody calls a couple of days later, and they find them dead. So I've been telling people to try to do that. I also talk to people about planning. What if somebody in your house is tested with COVID, but other people aren't? You know, do you have a room that can be isolated? Do you have these kind of things? I do that in the training I do, you know. So they can try to because there are a lot of folks who want to know what they should do, but a lot of times nobody's telling them because they think they're not going to do anything anyway, which is not true.
Right.
So
And go ahead.
Did you want to finish your thought, Dr. Isaac?
Well, you know, another thing, and this is another area that may be hard to hear, but you know, there's a saying that people find what they look for, but they look for what they know. If you go to the hospital and you're feeling sick and they tell you, well, we're not going to admit you, you can go home, you're okay. If all you know is racism, and when you're dealing with the healthcare system, and they tell you that you're okay to go home, people in the back of their mind are thinking, oh, they just don't want me there.
Mm-hmm.
And it may be a legitimate thing that, they are okay to go home, but they go back and they tell their friends, oh, they wouldn't have made me to the hospital because I'm Black. And that gets perpetuated. And then later on, you find people don't want to go to the hospital because, oh, they're not going to admit me anyway. And, and they may be going there for a legitimate reason, but, because of, again, that's another kind of unintended fallout from racism, is that a lot of people misinterpret things, even in well-meaning situations or in appropriate situations. You might not need to be in the hospital for your COVID, but they get that idea because of their previous experiences.
So I want us to talk about, another thing that's been on people's minds, and that is what's in this vaccine. And so I'd like for you guys to talk about just like what the difference is between the COVID vaccine and the flu vaccine, because those, two viruses have definitely been neck and neck in terms of people saying what's different between both of them.
Right. Well, the thing about COVID is that it's a brand new vaccine. And I think people have legitimate reason to be concerned about it. I was very concerned about it. I know Pat was concerned about it, that especially when they're politicized. We hear the president saying, we got this vaccine, and as a community, we're not sure if he really is pushing it because he wants to get reelected, or he pushed it because he thinks it's what's best for us. And most of us didn't believe that he was looking out for what's best for us, but he was looking out for himself. And so that already, adds a reluctance to get the vaccine. And then this, the whole thing, the Operation Warp Speed. We got this feeling that, okay, they're pushing this thing out of here, and we don't know. Can you hear me?
I can still hear you.
Okay, yeah. So we don't know if the vaccine is truly safe. As things moved along, and the fact that it came out after the election, I think made a difference. And then when you consider all the risk versus benefits, I myself felt okay with it. And so I got the vaccine a couple of weeks ago, my first vaccine. The next one coming up next week. So I myself feel okay with it, and I recommend it to my family and and my friends, my patients. But there is a legitimate reluctance to getting it. Now the flu vaccine, on the other hand, has been around for years. It's been proven safe and effective. Yeah, safe and effective. Not as effective as even the COVID, but it is out there. You can get that one. We're entering flu season now. I tell people you can't get COVID vaccine right now, but you can get the flu vaccine. At least the flu vaccine. That one's available. Go ahead and get it, and that at least we can take flu off the table and deal it, because we can't, with all the symptoms, you can't tell whether their fever or their body aches, whether that's from COVID or whether that's from the flu. At least just take care of the flu right now. Get that out.
Right. I know too, it's part of the educational session that we're doing. We make it very clear that, I made it very clear that I was not going to make the money for them to tell people they had to take the vaccine, they should take it. Our role in terms of educational standpoint is to give them as much information as they can to make a good decision.
Right.
Or decision for whatever they feel, good or bad, but it's their decision. And they're much more liable to listen to if they feel that you're not chastising them or penalizing them if they choose not to do it. I told people about watching MSNBC at least 12, 13, especially now that I'm home practically all the time. But Dionne Warwick was on there, and she wasn't there to talk about the vaccine. She was there to talk about, I guess, something she's doing in terms of Twitter with younger folks and everything, and how she's doing. And she looked 80, and Lord, she's 80, and boy, she looked 50. She looked great, as she really was. So at the last thing, at the end of the interview, the commentator asked her, had she gotten her vaccine, and she told him no. And then he said, "Oh, well, are you going to get the vaccine?" She said, "Well, I don't know. I'm going to wait." And it was interesting because he tried his best to push her into saying that she was going to get them. She held her ground. She never said I wasn't going to do it. And she just said she was just taking some time. And I said, that's me, listen to Kevin. Like I said, I've taken my flu vaccine already. I've taken that thing for years. It's automatic. I'm not an anti-vaxxer, you know. My daughter had hers, my grandkids have all theirs, you know, but you do have a right to kind of look and say, you know, kind of what's going on. And then the question that you asked about what's in the vaccines, you know, when you look at it, I mean, clearly letting people know they don't use, it's kind of weird because viruses aren't live. So you can't say you don't use live, you know, virus. That's an oxymoron kind of thing. But to say you don't do that, but you do alter, they're attenuated. You do alter what the virus is, and to make it not be able to trigger, if it gets close to somebody, try to trigger the part of the virus to make it infectious and whatever, and trying to you know, explain that, you know. And I know you're talking about one of the people on the we've done like 12 sessions now, and then somebody who's from the community and people know really very well, you know, she raised the issue that of hearing that there might have been reptiles or something that they use for that they put in the vaccines. And I thought it was kind of interesting because I did a whole lot. I tried to do as much research as I can, and I looked around, I called places, or I look up everything. And even when I tried to use Siri on my phone and said, you know, which vaccines has an animal in or something like that, you know. Well, all of a sudden I get referred to WebMD. I get mixed up when I'm not looking at it, but WebMD or MD Web, they're looking at this AstraZeneca, I guess that's not coming out, that hasn't come out yet. But it does. But it's interesting because when you look up AstraZeneca, they don't say anything about it. But in this MD Web, they do say that they use, rather than attenuating a virus cell, you know, from COVID, or they're using this mRNA, you know, there's a messenger. That's of the two. That's a messenger that really takes it off and goes places. That they mentioned in there about using cells. I'm going to be in a lot of trouble saying this, but I got to stay true to being true to people. But they did say, but I haven't been able to really validate it, and that's why I'm make sure I put that on there. But that MD Web does say that they use cells from chimpanzees. Now, you know, for Black folks, come on now, that's going. That's good. So that's why I really I'm on this program now, right? So it'll be out there. Look, but that's the reason. But I'm saying it hasn't been authenticated. You know, I'm putting that out there. But I wonder, like, you go into AstraZeneca, I'm looking up, reading all their stuff out of there. They never mention that in their, you know, when you go to their website, they never say anything about that. So can't confirm it. I'm not sure this WebMD would have done it had they I don't know why they did it, but that is what was said. And I was like, oh, good. I'm gonna go back and tell Black folks about the monkeys. You know, they got monkeys. I'm not. I'm not. You know, if they hear about it, they ask me about it. I'll just say it's not confirmed. But I am. That is what I saw. I mean, it is what I got the paper right here. It is what there's. I'm just repeating there, but not repeating it as misinformation. I don't know yet if it is.
Gotcha. It's definitely medical professionals to kind of put that disclaimer on there. Just want to let people know that you are watching a conversation about vaccine hesitancy from Listen MKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal Sentinel, the Milwaukee Public Library, and Milwaukee PBS. And please be sure to tune into The Vaccine, a Milwaukee PBS special that will be airing February 4th at 7 p.m. on Channel 10 if you're interested in looking into this topic more. Now, one of the questions that I had is something that you mentioned, Dr. Izzard, which is that it can be difficult for people to do, you know, the things required to get this vaccine. Let's say there is someone who wants to get the vaccine, but they don't have a primary doctor. And so that's one of the things you hear is like, oh, reach out to your primary doctor and then they can kind of arrange things for you. What should people in that position do?
I tell you, the whole rollout's been a mess. And I think most of us realize that. And personally, I think it's because the leadership was messed up in the beginning. But that being what it is, we've been told if you look at the journal, you watch TV, you've been told, oh, if you're a senior citizen, if you're over 70, you can go to the convention center and get vaccinated. Well, you call the convention center and they say, no, that's not true. It hasn't been approved yet. refer you back to a website with the state. You go to the state website. They're unclear about who's in group 2B or 1B and who's not in group
Right.
1B. And so people are just kind of very confused about how to even get access to this vaccine. And so, and my mother-in-law, is willing to get it, but she called to the convention center. They said, call your primary doctor. Well, depending on who your primary doctor is, they may not have access. We have 2 vaccines right now that have been approved: the Pfizer and the Moderna. The Pfizer vaccine has to be kept in a deep freeze, and most doctors' offices are not going to be able to do that. And so, unless you're with one of the big healthcare systems, unless you're with Ascension or Aurora or Freighter, you're not going to be able to even get that vaccine. And you might be able to get the Moderna vaccine, but there's fewer of those doses around. And so it's very confusing about who's getting it. And then you hear stories about, because the vaccine has to be used in a certain amount of time, that a lot of times those pharmacies or whoever has it is vaccinating people who aren't even part of those priority groups, just so they don't waste the vaccine. And so now you're hearing about people who are friends of people that work in a clinic or other people that are getting the vaccine at the detriment of other people who really want to get it and who need it but can't get it. Mm-hmm. So that all that's added to the confusion, and then and eventually adds to suspicion too. Well, why? How come this lady down the street, her cousin got it, but I'm not able to get it, and I'm older than that person, and I'm sick. So that just adds to the confusion. And so somehow we had to rein this thing back in and either give it to everybody, and that might be through pharmacies and doctor's offices. But a lot of doctor's offices, especially the doctor's offices of minority doctors, they don't have access to it because you have to be in one of these big systems to be able to get it. And so even Cream City doctors, up until recently, weren't even able to get the vaccine. And that's the doctors and the healthcare people. So I don't know how we're going to get to the point where we're going to be able to vaccinate our patients.
And did you see, Kevin, did you see that 2 days ago, our wonderful mayor, now they've said that anybody over 65, because of the question about people are not getting the vaccines in the way they should, now they're saying anybody over 65 can't get the vaccine. That's the group they decided to push over into the river.
Yeah.
And it's kind of like, well, wait a minute, that's the group that's been the highest in terms of risk in the first place, and you're going to stop them from getting. But it was, I think it was 2 days ago he announced it's supposed to be because not having any vaccine, but you still got some, but you've made some decision. And for Black people, you're looking at the population that's most at risk for it, that has died the most have been people over 65. And now you're not, I don't know if you thought you wiped them out already or what, but you kind of figure like, excuse me. I mean, apparently I don't know who in the community at all that they even talked to. I guess they did their public health thing, which means they just made their own decision. But that's kind of scary when you know that that's the most at-risk group for Black people right now, especially in Milwaukee. It may not be the case across the country, but clearly in Milwaukee it is. That they just say, not now, they just said as of yesterday, or like I said, I think it was 2 days ago, that was the decision until we get more vaccine in, or not saying we're going to cut back at least on the vaccine for that age, or something like that. Just nobody over 65 can get it, And
so
I think
what we really need to do is just have mass vaccines. Just say, okay, the convention center will be open 24 hours because you got people that work third shift or maybe till midnight or something, but extended hours, 7 days a week, come in, get your shot. That way, I think it's going to have to work. But trying to make appointments, again, a lot depends on whether you have a primary care doctor and whether you can get into that primary care doctor, and if that primary care doctor even has access to the vaccine.
Yeah, and even, go ahead. I'm sorry.
Can you talk about how the speed of the vaccine's development is contributing to some of the concerns around it?
Oh, absolutely. I mean, that pushed it into a political realm, and a politician, our former president, Lord have mercy. I mean, when you name it Project, Warp Speed, and you're trying, but you're still not working with the experts who are in the area to how it should be fixed, where it should go, who should get it. It really pushed back. I think I think it almost moved it from vaccine hesitancy to vaccine resistance, because people aren't, but they see that, that they're watching all this stuff on TV, every place else, and they're like, what? They're saying that. I mean, he gets on there and he tells them they should to do bleach and they should do all these other kind of crazy stuff. And you still and people who are already nervous already, because those things have been brought up in my sessions too. When people say, "Oh, how do you expect us to trust that? We don't trust them anyway." And so now we really don't trust. And the question too, when it says, like you said, Kevin, I've been really frustrated about this. All the whether it's the state health department or whether it's the city or other people, some of the other major, but they all call your doctor first. Like that's a norm. That is not a norm for our people to put that. They don't say call it, and if you don't have a doctor, do this. They just leave that. Call your doctor first. And that right there has been confusion. We get a lot of calls from people trying to figure out what to do, when to do it. And the community health centers certainly have been trying to meet the goal, but they're struck too. And even they get put it bluntly discriminated against in terms of, like you said, a lot of these major health systems, they get them and they're kind of threatening they basically are telling their folks they got to get the vaccine and stuff like that. And that was coming up sooner or later. And I'm sure that's going to be, when I worked for the health department, I had to get vaccines. I had most of them anyway, but not the ones that I usually don't get, the ones that are usually prescribed by my physician. But they're saying now that they're going to be telling people, so people be ready to go back to a job, and they say, well, you got to have vaccine to go back. You got to be vaccinated to go back to the job. Now, you certainly can understand that from a logistical standpoint of, you don't want somebody in there who's not, that could bring in the disease or something. But again, they're not telling people that's something that it could move to that point sometime. And if we're the last ones that are getting the vaccine, the first ones, we're the first ones that are going to not be able to come back to our job. If we can't, to a lot of people, that's like, well, it's a death sentence one way or the other. Either I don't get it, and then maybe I could make it through, or if I get it, I could die. When when they say that Henry Aaron had gotten the now that's another thing, Kevin. The fact that they said that Henry Aaron had gotten the vaccine 5 days before he died. Come on. More people say stuff to me like, "What? Did you hear?" I said, "Oh God, no." I said, "Yeah, oh my God, yes, I heard that." And I guess the commentator Larry King, I guess he actually had COVID. They didn't say that he was sick right now, but it's just pushing it back, and especially when it's just, like you were saying, Kevin. There's no real plan. The plan was somehow not the plan, and now they're trying to do something with the new people coming in. But they were lied to like everything else, because they told them that they had a plan. So then they thought, well, good, we'll just go in and make sure the plan is viable. But my understanding is when they got in there was no plan at all. All the discussions and everything, no plan. So they're starting from scratch.
Not only was there not a plan, there was supposed to have been a repository of vaccine that they had observed.
Right.
And then they find out it's all gone.
There was nothing there.
They depend on that money, that vaccine being there.
No plan, no nothing. And so all that's piled on top, like you said, of a group of people who I think, the way we've been treated in this community, have a right to be a little hesitant. And so, but I thought, when I mentioned about Dionne Warwick again, was that, like I said, I watch MSNBC all the time, and somebody of her caliber, they would have taken pieces of her, her present, what she did, and probably gave it to other areas. It would like shut down, boom. I ask people now, they didn't have to just see her that time. In other words, because I suppose they'll probably screen everybody now and ask them if they got the vaccine or if they're for the vaccine before they let them come on. They'll probably do that now. But he really tried to get her to say that she was going to take it. And she said, well, no, I'm looking. I'm take away time, and boom, you get isolated. And folks know that too. Then they're kind of like, oh, so that's what they do to you if you don't kind of do what they. I mean, it's crazy.
That brings up a good point, and that's another reason why you need people like us on the front of this. People need to know that you are talking to them straight, because there are competing interests involved here. There are the pharmaceutical companies that are making a huge amount of money in these vaccinations. There's the whole idea that we have to have a certain number of people get this vaccine for it to work. So we got to get like 60% of people to get the vaccine, which means we got to sell this thing. Okay, now are we going to sell this thing at the detriment of our patients?
Yeah, right.
And that's where we're left in the middle here, because we want to get accurate information, safe. We want this thing to be safe. We want it to be accessible. We want it to be effective. But all those things may not necessarily be the case. And I can tell you, eventually, it hasn't happened just yet, but eventually somebody's going to have a bad side effect from it. Okay, and that's going to get out there, and that's going to set everything back. But we know that's going to happen, because when you start getting millions of people getting a vaccine or any medication, somebody's going to have side effects. Okay, so we have to be able to sell this thing in an honest way, and our patients are looking to us to tell them, okay, be straight with me. Is this okay? So we're, in a lot of ways, we're kind of sticking our neck out, saying, okay, I think it's okay. Go ahead and get it. But we want to make sure that before we tell our patients and the people that ask us, before we use our political capital and say, yeah, go ahead and get this, we want to make sure that it's okay.
To that point, this kind of goes back to something we just discussed. There is this vaccine hesitancy, especially in communities of color, especially in the Black community. And yet, as you mentioned, Dr. McManus, Black people who get COVID are more likely to die. And so there's kind of this equity issue. How are you thinking about that? How are you looking to address that? Because you don't want to get into a situation where you do advocate for that equity piece, but then there's so much hesitancy that these vaccines aren't being taken. How are you dealing with that?
Well, I think what I always do is just tell the truth. I mean, I think that's where I've earned the respect I have. They may not want to hear what I have to say sometimes, but I'm still telling the truth that I know. And I usually do my research before I say anything, even about this thing with that I found out about the chimpanzees or whatever. When I read what they said they did, it seemed to make sense based on how they did everything else. You know, it's no different than using the messenger RNA than using this with it the same way, but people are kind of hiding it. And to me, that just makes it worse that they're not coming out and saying, because like I said, why doesn't AstraZeneca have that in there? Because I was thinking even about, well, I would go with AstraZeneca because I wasn't going to go. I want to go to the next one because they all have these 2 shots. They have 2 shots as well. But this again, it was the WebMD that really kind of outlined how they're using it. And I'm reading it and I'm like, well, this seems to be consistent with what they're doing with the mRNA. So, but I know they're not saying it because of what might come out of it, but then that just makes things worse when you continue to hide stuff, you know, and they don't, rather than saying, if you believe that this is right, then you need to kind of step out on that, and you're not going to get everybody, and somebody's going to say something anyway. But I think it doesn't help. It doesn't help people to understand, especially in public health. Public health, I've said this before, unlike healthcare, we don't have anywhere near the number of doctors and nurses and other health professionals we should have. We still are so woefully. I know with nursing, it's less than 5%. How about you, Kevin? I bet you it's not much higher than that for that position.
Yeah.
Lower. Nurses,
especially in Milwaukee.
Yeah, 5%. Yeah, especially. And so that you don't have those anyway. It's already so low. But the folks who are there, they're trying to make sure that we do what we need to do with our could help, but we need to get the information out as well. And they treat, and like I said, I was probably using Dr. Moore for I don't know how long because I was so distressed with the way she was treated. And see people want to say, well, that's an aberrancy. No, it's not. It happens almost daily and in places. And so how do we fight that? As a person myself, I can only go by, and I've had people say that to me because we laugh because they're like, well, you know, Doc, you know, I don't know if I like everything you say, but I trust what you say. Okay, I mean that's what I do my job for, is to make sure that they come to people and they trust who it is, and it's not just trusting because somebody. Because then we have Black doctors and nurses who don't act like they got good sense either. You
Right.
know, I've seen people mistreated by Black doctors and Black nurses too. You know, and so that, because I don't know, part of it is their own ability to get over their own how they were treated. You know, sometimes in medical school, nursing school, or whatever, that they don't even see that they're reinforcing that when they all of a sudden take on what they think about Black people, and then it makes Black people feel. And I heard somebody said this in one of our sessions, that we can't even. I don't know if we can even trust Black doctors and nurses. And it's not so much not trusting them in their ability, because they couldn't have got through there. They didn't know what they were doing. But do you care about us? That's
Right.
what, if that makes sense. That's what somebody said. And I think that's still one of the major problems, especially in a city like Milwaukee. I tell people all the time, Milwaukee is unique in that even the number of Black people we have here, most others, but we're trapped. You know, we're trapped by Lake Michigan, and we're trapped by all these white suburbs that don't want us there. I mean, you know, even, you know, most other places, even like St. Louis and all these other places, they at least have a Section 8 housing. We don't have any of that in Milwaukee, in the Milwaukee area. We have none of, we don't have any of the transit. The people could go, you know, transit, the people go out to get those jobs out there, where you got 60% of the folks out there coming into Milwaukee and taking the jobs. But nobody wants to do that. I mean, we don't have anybody that really is pushing. And then in Milwaukee proper, the city of Milwaukee, it's kind of the same thing. You get used you get pushed into the politics because you feel that's the only way you can get anything done, and then you still don't get it done that really meets the needs of the larger collective, not just the individual person who may have I know that person, I can do this, I know that person, I can do that. But what do we do? And you talk about historical trauma? Absolutely. I'm born, you know, like Kevin, I'm born and raised here. I've been here all my life. So if nothing else, I got to watch all this stuff, you know, and what's going on. And it does make a difference.
Yeah, and to that, to Dr. Israel, can you talk a little bit about, you mentioned that history, Dr. McManus, a little bit about what the Cream City Medical Society is, and kind of what your role is in educating people about this vaccine as part of it.
Okay. Yeah, Cream City, for those who don't know, is an organization for doctors who are interested in treating issues that are specific to the Black community. They don't necessarily have to be Black doctors. They have white doctors, Hispanic doctors also in our organization. And not just doctors. We have nurses, we have pharmacists and podiatrists, other people. But the idea is Cream City is going to be 100 years old. We're 97 years old. 97 years ago, and actually 125 years ago, when the NMA, which is our partner organization, 125 years ago, Black doctors couldn't be a part of the AMA. And so the doctors decided that they would come together and form their own organization, and that was the National Medical Association, the NMA. And Cream City is the local Wisconsin chapter of the NMA. And so what we do is we try to figure out first of all what's going to be our issues, because there's so many ones out there. But we deal with things like recruitment and training of residents and medical students. That's a big one we're working on right now, trying to get more Black doctors, more medical students. We have scholarships to support the students. We have fundraisers to raise the money for the scholarships to support the medical students. We deal with issues of diversity in healthcare, and making sure that our patients have access to good healthcare. We deal with disparities is a big issue. The disparities in access, disparities in quality of treatment, disparities in location and access. And so that's a big area. And then some of it also is in trying to support ourselves, because there are so few Black health professionals in the area. We talked about distrust of doctors because patients think that they're beholden to somebody else. Well, a generation ago, there were quite a few black doctors who were and black professionals who were independent. They worked for themselves. Now everybody works for
That,
healthcare systems,
that's true.
you know. And so
True.
when you work for Freighter, or you work for Aurora, or you work for Ascension, they basically make the policy. And
Yeah.
so the doctors are now kind of stuck. Well, okay, I don't believe this should be the policy, but I work for this healthcare system, and that's the way it is. What do so you try to make change within the system, but you no longer are in charge of it. So those are all the kind of things that we deal with. And so Inclusivity again has been around for a while. We try to partner with organizations like the Black Health Coalition, Black Nurses Association, other organizations that are out there, to try to pool our resources and to come collectively. But it's a battle. It's a battle, from year to year for a lot of Black doctors to keep the practices open, especially if they're independent, because you're competing against all those big organizations.
Tell them about, Kevin, when you were going and passing out the mask and stuff, and how some of the places wouldn't even let you come.
Yeah. So we were, when COVID first started back, we're talking about back in March, and so we said, okay, we gotta get the word out there about masks. So we were on the radio, we were on TV, try to tell people to wear masks, social distance, all that stuff. So then we said, okay, why don't we? So we actually found someone who donated some masks, and we said, well, let's get some more masks. So we said, okay, let's do a community give out. So we decided we were going to go outside of Walmart, outside the store. We were going to go outside of Walmart and deliver masks, because that's where Black people were going in the community. They didn't want to come out to Walmart, and we were just going to give them away for free, which made no sense to me. So finally, Pick and Save said, okay, you can come, you come there, but sometimes for whatever reason, there's resistance to that. I don't know if it was for, I don't know whatever the reason was. I'm not gonna try to guess, but we run into issues like that. Resistance for whatever reason.
We're not talking 4 years ago. We're talking last year.
Right.
So we can definitely have this conversation longer than we have time for today. But I'm gonna just draw us to a close here. But one more question. We have about 8 minutes. Let's say someone has simply decided they're not going to take the vaccine. What would you advise them to do? Dr. Izzard, you can take that first.
Okay, I would say this: if you're not going to take the vaccine, or you decide you want to wait, I think that's reasonable. Decide that you want to wait. Even if you decide not to take the vaccine, I think it's reasonable. But what you got to realize is that you have to wait until everybody is able to, until we get enough people to get herd immunity. So we're talking about 60% of people. We're talking about probably the fall before that happens. So until that time, wear your mask. I know that I was listening to the CDC just the other day. They kind of upped their recommendation for as far as masks. They're saying if you can get access to the N95 mask, wear an N95 mask. So you can get that. I went on Walmart. Not Walmart, but Amazon. They still have access to those. So you can order an N95 mask. It filters 95% of the particles. So that's a way better mask than the or the homemade mask. So get those masks, do the social distancing, and ride it out.
Dr. McManus, anything you wanted to add in about 2 minutes?
Yeah. Well, I agree with what he said. Also add to avoid the large parties and, even family gatherings, which is really hard to do. We Black people, we like to get together and move.
Right.
Avoid that. I mean, I haven't been to a birthday party of my grandkids all year. I stay here. I to learn how to do it. So the mitigating pieces of it, and also stay out of the bars. If you need to drink something, buy it at the store and go home, because that's clearly one of the major areas that they're finding that it's spreading as far as it is. So I agree with Kevin. If you make that decision, then at least we can tell them these things you got to do. Plus, even now, I make the comment now, when they got these people on the air, they're taking the vaccine and they're taking their mask off and they're waving it. No, put it back on. You won't, if it's going to work, you got 2 more weeks before you get your antibodies in order. So what are you doing by telling
Right.
people I could just take it off and I'm okay. So there just needs to be a little more consistent in information that understand if they get the vaccine. And then the other thing too is that to make sure the people in your house are staying within that group. My granddaughter, you know, she's gone some places, then she quarantines for 2 weeks before she comes by my house, you know, and something like that. I mean, so trying to find other ways to get people who, if they choose not to, these are the things that you're going to have to figure out how to do.
That is some great advice, and that will wrap things up for us. This has been a conversation about vaccine hesitancy from Listen MKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal Sentinel, the Milwaukee Public Library, and Milwaukee PBS. We want to thank our guests, Dr. Kevin Izzard, president of the Cream City Medical Society, and Dr. Patricia McManus, president of the Black Health Coalition of Wisconsin. And again, we want to remind people that if they want to learn more about this topic, please tune in to The Vaccine, a Milwaukee PBS special that will be airing February 4th at 7 p.m. on Channel 10. Thanks, everyone.
Thank you.
Thank you.
Bye.